Unfortunately, even having a negative test does not guarantee that you will remain negative and not contagious for COVID. The rapid tests and even the less rapid PCR tests really only give you a snapshot for one moment in time. So just because you test negative today doesn't mean that you'll remain negative and not contagious, 2 or 3 days from now. It can really change very rapidly. Right now, there are so many different testing options, some of which you can do from your home and you don't even have to leave. You can just do it by mail. It's really hard to figure out exactly what kind of test you're getting. There are two basic types right now for testing to see if you're contagious. One of those is the PCR test, which looks for the virus nucleic acid itself. The other one is the antigen, which looks for bits of the virus. Both of these can be done rapidly, but it's the antigen test that I think most people consider to be the rapid test. These can give you results within just a few minutes. These are available at a variety of places in the peninsula. Now, those tests are not recommended for people who are asymptomatic. They don't work very well for people who aren't having symptoms. So those rapid antigen tests can give both false positives, making you think that you're contagious when you're not. They can also give false negatives where they fail to detect virus that's actually there while you are contagious. So those antigen tests, it's important to ask what kind of tests you're getting. The antigen tests are not for people who are not having symptoms. They perform much better for people who are already sick with symptoms. Right. In the last 2 weeks, we've seen a very sharp and alarming increase in the number of cases as well as the number of hospitalizations. What we're seeing is that we see multiple family members coming in. Everyone in the household is sick, and oftentimes 2 or 3 of the most vulnerable family members require hospitalization because they are so sick. These families are getting multiple family members infected because of large gatherings. We've seen families get ill because of birthday parties, because of weddings, because of baby showers, to a lesser extent Halloween parties, but that was also a factor in this recent increase. But it's often more of these just traditional reasons that people get together as a big extended family. And like I said, unfortunately, we'll see 4, 5, 6 family members all ill, and 2 or 3 of them will end up in the hospital. Right. So obviously, Thanksgiving has long been a family holiday with very large family gatherings of sometimes dozens of people getting together to spend time to give thanks. Unfortunately, we know that that's going to be a tremendous risk for families, particularly those that have people who are older and more vulnerable to getting severe infection. Getting tested in advance is not a great strategy for preventing transmission among family members, again, because you won't know on the day of whether or not that test you took a couple days ago is still accurate or valid. The best thing is to follow the guidelines from the health department, which really at this point says gatherings of more than 3 households are really prohibited. So finding other ways to engage and visit with family, whether that's through video links, or I've heard other strategies where families will simultaneously celebrate, but each in their own home, calling each other to do a traditional Thanksgiving toast. These are great ideas to really keep everybody healthy and safe.